125 years ago, the U.S. Army Medical School was founded by Surgeon General George Miller Sternberg. General Sternberg sought to provide military physicians with the unique knowledge, both art and science, required to save soldiers' lives. In subsequent years, the Army Medical School was joined by nursing, dental, and veterinary schools, creating the military medical professions that would lead to the discovery of both treatments and preventative measures against infectious diseases and the unique hazards of war. In the late 19th and early 20th centuries, the medical school's faculty was comprised of experts from across the service who did their research at Army camps all over the U.S. and abroad. With Captain Walter Reed as the first secretary of the school, the Typhoid Board determined how typhoid was transmitted and developed protocols to prevent its spread in Army camps. In 1900, Major Reed, Cuban researcher Carlos Finlay, and others advanced the theory that the disease was caused by a virus and that mosquitoes were the vectors of diseases like yellow fever and malaria. With this discovery, Colonel William Gorgas reduced mosquito populations in Cuba and the Panama Canal construction zone. Yellow fever incidents plummeted in Cuba and Panama. The Army Medical School's professor of chemistry, Major Carl Rogers Darnell, invented the liquid chlorine method of water purification, still used today, and later, Army researchers developed field chlorination. These pioneers of disease surveillance and medical breakthroughs fielded America's first typhoid vaccine. They pushed forward with the first vaccination of the entire force and, based on the typhoid disease threat of the time, likely saved many soldiers from illness and death. With each medical research advance at RARE, it became clear that research and medical care deserved special focus, and today's Walter Reed Army Institute of Research was so named in 1955. We've continued to evolve through the years, growing in scope and mission, but always dedicated to finding solutions as we did through our history as the Army Medical School. We protect and improve soldier health, and with those solutions, we help protect world health. RARE's mission remains to support the health and medical readiness of U.S. forces. Together, we are 2,000 military, civilian, and contract staff located around the world, leading the change from basic research to product development and clinical trials. When we conduct disease surveillance and countermeasure research, you can find us in Southeast Asia, Sub-Saharan Africa, in the Caucasus region, and here in the United States. Whether it's being part of bringing every antimalarial to market or driving the development of the first and subsequent vaccines for Japanese encephalitis and adenovirus, RARE develops products that saves lives. We meet the ever-changing threats to the health of our service members and find answers through our capabilities such as pilot bioproduction, biologics, our vector insectary, and the Clinical Trials Center. Emerging threats like Zika, Middle East Respiratory Syndrome, and scrub typhus, while new threats are really nothing new to us. This year, we celebrate 125 years of existence, standing on the shoulders of those who came before us and looking forward to finding and stopping the next threat. So long as infectious diseases persist, we will be here to find solutions.